So this is the Molli surgical system. Number one piece is the marker. It's a small, solid metal, metallic seed that is placed in radiology via ultrasound or mammography. And it can be placed up to 30 days prior to surgery. These cases will be labeled wireless localization lumpectomies. And since they're being lobed ahead of time, sometimes they can come in morning of surgery, 7 a.m., they could be in pre-op. So something to be aware of if you're used to patients coming from the surgery center, or coming from the cancer center. Number 2 and 3 here are the tablet and wand. The tablet is battery powered. When not in use, please plug in with the charger here. Looks like a little laptop charger, plugs in right above the white piece and just plugs into an outlet there. The system you guys have will have a IV pole attachment, so you can attach it to an IV pole, or you can place it on a stand directly in the surgeon's line of sight. Next is the wand. Easy to connect and disconnect. You guys are wiping these down with stereo wipes prior to and after cases, and then they are placed in a sterile drape that will be located in the core. The wrapping will be these numbers here, and the box will say Molli drape on them, or Molli probe cover. Easy to use. There's 2 plastic pieces up here at the top. You just spread those and squeeze, and then you drop the wand directly down the middle with it attached to the cord. So to attach the cord, goes red dot to red dot, and it also lines directly up with the O in Molli. Just a push, don't twist or anything like that, don't want to bend the pins. So then we drop it in, sterile procedure there, and it's fitted to the tip. So you can push that forward where it fits in the tip there. And then the unsterile person will pull this white tab, and it goes the length of the cord on the sterile field. So once that's connected, use this wand to locate the localized area. That white dot on the screen is real-time location of the wand in reference to the marker. When you get right on top, that green dot shows up there, letting you know that you're pointing directly at it. So it's omnidirectional sensation here. Don't have to be looking at it, but when you are, it lets you know. So on the tablet, there are volume buttons on the top, volume up, volume down, and a power button. To turn off, it's a long, like a 10-second press to turn off the tablet. To turn it on, it comes through. It has like a 5-minute boot up sequence. And then try to leave it alone when you turn it on, because if you touch the screen too much, the program might not open. And to fix that, you just turn it off, turn it back on. For the first time in the day, when you turn it on and you plug in the wand, it's going to automatically do this wand check. So that button there in the top, and you just spin the wand back and forth for about 3 seconds in like a helicopter motion. Hold it away from any instruments or anything like that, and that just calibrates the wand. And if for whatever reason in a case it's acting weird or funky, just hit that button there. It takes 3 seconds to calibrate it, and then you're good to go. Doesn't happen very often, and however many cases I've done, I've only done it once intraoperatively. And then contraindications for this, number 1 is a pacemaker. It cannot, as of this moment, a marker cannot be placed in the same breast as a pacemaker. It can be placed contralaterally, but cannot be placed in the same breast as a pacemaker. And then if the patient has a nickel allergy is another contraindication. So nickel allergy and pacemaker are 2 main contraindications there. Some things to be aware of in the case. Sometimes your instruments can be magnetized. An example of this is this pen is metal, and it gives off a little bit of a signal on the screen. Sometimes instruments can be highly magnetized to where that number on the top will register in a single digit. That has the potential to interfere with the case. So If we need to, I can come in and demagnetize instruments in SPD. We haven't needed to so far, but something to be aware of, you can get a reading from your instruments. And then secondly, the marker is a magnet, so it can stick to your instruments. So if the surgeon clips directly to it with an Alice clamp or cuts on it with a knife, like Dr. Woolen, that it might stick to that instrument. So it's something to be aware of. If you guys stop getting a reading in the cavity, look at your instruments and make sure it's not stuck to something. But that is the whole spiel there.